Hospice, watching over you.
Welcome to Healthcare in Your Home, featuring Dr. Rosenberg and Dr. Quall. Brought to you by Great Lakes Home Health and Hospice, where superior quality care is our passion.
Great Lakes Home Health and Hospice, watching over you.
What is home medical equipment?
Home medical equipment is all those things that a person needs either in a recovery situation. For example, a person who's had a hip or a knee replacement and they may need some temporary equipment, or for people who have long-term care needs in their home, things like oxygen in the home.
Home is where our heart is. Home is where we feel best. Home is where we have all of the things that complete us. And with the advent of home medical equipment, we can maintain that lifestyle at home, have a better quality of life, increase possibly, or at least continue our activities of daily living and become more functional. So it's really been a benefit in terms of long-term health care.
What are some examples of home medical equipment?
Rehabilitation equipment are generally devices that are used on a more temporary basis following an acute illness or surgery or an injury, and are designed to assist in healing and decrease rehab time. They've also been shown to be effective at decreasing time spent in the hospital.
So let's say, for example, your grandkids are visiting from Texas and you want to take little Joey out to the park, but your oxygen is a problem because you can't live without your oxygen. You know, once upon a time, you were, only able to go as far as the tube. So if the tube was 5 feet long, you can walk 5 feet long. It's like, unfortunately, being a dog on a leash, and that's just no way to live. Now we have some wonderful portable oxygen devices, some that are very, very lightweight, not just the heavy ones we used to push along the street. So with these portable units, we strap it on, we have an hour, maybe 2 hours of oxygen. We could take Joey to the park, take Joey to a movie. Quality of life is improved. And again, I want to emphasize that quality of life is key for patients as they get ill, so that they can maintain the usual activities of daily living or the things that improve their own quality of life.
I go to the movies and I go out to dinner all the time and go out, and I go out to Judy's a lot on Sundays, and I go anywhere I want now. Now I wouldn't have been able to do it if I couldn't have had this.
Assistive devices are used to help people on a more chronic or long-term basis, as opposed to a temporary basis. So if an injury or illness results in a more permanent condition, assistive devices are there to provide the patient with increased independence, increased safety, and they can provide some healing factors as well.
In the home environment, when they're using a CPAP or a BiPAP unit, it's because they're not getting continuous oxygenation, and especially when they sleep. So if we use those units when they sleep, it'll stop them from having the problems with oxygenation. It will allow the continuous good flow of oxygen so that they're continually breathing. It'll allow them to have a sleepful night as opposed to a sleepless night. And what happens with in the patient with the apnea, they get hypoxic, meaning the low oxygen. They wake up, they're startled, and it disrupts that sleep pattern. And that disruptive sleep pattern really can affect our daily living because we're tired all the time. So again, we're going back to a CPAP and BiPAP unit. How does that help? It's home medical equipment. It's helping us with our quality of life. It's helping us improve our activities of daily living. It helps the overall global well-being.
What about service and support?
Every single time I have ever called them, they've come out to the house because I was really frightened of the oxygen in the beginning.
Medical equipment is complicated stuff. And to say that in the case of oxygen equipment, after 36 months, the people using the equipment have to purchase it and service it and maintain it themselves makes no sense, because most of these people are elderly, or in some way unable physically to handle equipment like this, or they wouldn't be on oxygen. So to say that they have to do it themselves and not be able to depend on professionals to do it makes absolutely no sense whatsoever.
Well, I think anytime a patient's at home using anything that's medical, it's a little foreign to them. And it should be. I mean, as a physician, I'm comfortable with it, but my patients who's an accountant or a lawyer or a contractor or is working at a department store, this is stuff that's foreign to them. They need to know that they have backup. They need to know that if, God forbid, there's a problem at any time of day, 7 days a week, 24 hours a day, with the equipment, that they can call. And that's key. You want to be able to use a home health agency that's supplying the home medical equipment that you can get on the phone and say, you know what, I'm having a problem and it may sound real silly, but I'm just not comfortable with it. Can you help walk me through it?
Generally, from my experience, home medical companies really go overboard on explanations and information regarding this equipment, which is a good thing. It generally leads to decreased anxiety on the patient's part, and I think improves the patient's use of this equipment.
What current things are being done concerning home medical equipment?
We introduced House Bill 5513, which reverses language in the recent budget reconciliation bill, which essentially says that the professional providers of medical oxygen equipment will continue to own and maintain the equipment. This is a safety measure. It's good medicine. It's going to prevent accidents. It's going to prevent equipment from not functioning, which certainly is going to happen. People on oxygen don't need to worry about whether their equipment functions or not. What they need to worry about is their own health and well-being, and they have to have confidence that the equipment is going to work. That way, I think things are a lot better than the way they would be with this, were this bill not to pass. So the professional providers of oxygen equipment should be the ones responsible for the maintenance and the owners of the equipment, so that the people using it simply use it for their benefit, and they don't have to worry about a bunch of other stuff that they really should not have to worry about. Numbers of my co-authors of this bill in the Congress are physicians. There are 9 physicians in the U.S. House of Representatives, and other members of Congress, a number of them, signed on to a letter in support of this bill. And of course, people who understand the issue here, and that is that people on oxygen should not have to be worried about maintenance of this stuff, maintenance of the equipment. They are users. They're not maintainers. They're patients. There are people who depend upon the providers of this equipment, and the providers of this equipment are quite happy to maintain it, to provide the oxygen and make sure it is safe. And safety is the big question here, not only appropriate operation of the equipment, but the fact, you know what, oxygen blows up. And we don't want accidents to happen, and accidents will happen if the equipment isn't maintained appropriately by professionals. It's important to me because I want health care to be the best we can possibly have. There are numbers of people on oxygen. And these people, people with chronic lung disease, chronic obstructive pulmonary disease, pulmonary fibrosis, lung cancer, all manner of lung disease where they can't make the proper oxygen exchange themselves, and they depend on supplemental oxygen. And my response to them is, look, you need not have to be mandated by the federal government to purchase this equipment after 36 months. There are professionals out there who will maintain it, who will supply your oxygen. You simply use it, and use it in good health.
Where can I find out more?
The first source I would go to is my primary care provider. Patients can get usually a wealth of knowledge from these individuals. They're usually well versed in providing pretty detailed information on both the proper function, use, and which equipment is best for their healthcare needs. Also, I would call the local healthcare companies that are actually providing this equipment.
Great Lakes Home Health and Hospice, watching over you.